Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Today's program is Natural Therapeutics in the Treatment of Multiple Sclerosis. If either you, a loved one, or anyone that you know is suffering from multiple sclerosis, please take heed in everything that I have to impart to you today. Multiple sclerosis is going to be cured in our lifetime. Until that happens, we need to make sure that people that are afflicted with this disorder have minimal symptoms so that when a cure is available, that they are allowed to heal to a greater extent. Multiple sclerosis is a disease and disorder of the central nervous system that affects the covering of the nerves. Those coverings of the nerves are called the myelin sheath. The myelin sheath with this disorder gets degenerated and causes the nerves to basically short out. And then it goes through a process of regeneration and the patient goes into remission. On average, women have a tendency of getting multiple sclerosis slightly more than men. The average onset of the disorder is in the neighborhood of about 36 years old. The etiology or the cause of multiple sclerosis is not completely understood at this time. We know that genes play a role and a component of it. There is evidence that viruses may be involved in the condition, autoimmune components of it, toxicity. So there's a lot of different things that are being juggled around right now to get clarity on the exact causation of this disorder. However, until all of that is all cleared up, we need to know what's available for us to do to help to manage this condition. Now, from my experience, I've seen the condition in my practice a good 100 times. And I would say 50% of those patients that I've seen had some type of emotional trauma prior to the onset of their original symptomatology. I really haven't read this, but when I talk and take history of these patients, and I would like to hear from you if you have a story like that, please, I'm very, very interested in hearing that. We have the top 10 stresses in the world: a death of a parent, death of a spouse or a loved one, a marriage falling apart, loss of a job. These types of big life stresses, I've often found has been a prelude to the onset of the condition. That's not to say that it caused it, but I think when that predisposition for that problem is there, that's the catalyst for helping to trigger it off. The symptoms associated with the condition can be starting with fatigue, numbness into the extremities. Then we have a lack of coordination, especially with walking. We'll get enuresis, which is bladder problems and difficulty on urination. Sometimes people will have to catheterize themselves so that they can urinate. Now, the condition can either be mild or it can be very, very severe when a patient has it. The goal is to minimize the symptoms, increase the periods of the remission, and make it so that you don't become a victim of the disease. So sometimes people will get it, the initial onset won't be that severe, and then gradually it'll go away. Then the goal is to have it stay away or be in remission for prolonged periods of time. And then sometimes people will get another bout. What triggers that off? I have my suspicions, which I'm going to talk to you about, but it's not fully clear yet what does that. Now, before we talk about the mechanics of the disease and the disorder, I want to go over with you some additional things that I want you to think about if you have this. We've spoken before about an alkalizing diet, and an alkalizing diet is helpful in curing and remitting many degenerative disorders. And it's very, very important that an alkaline diet is in place when one has multiple sclerosis and is diagnosed with that condition. The other thing is, I was talking before about emotional traumas that take place, prior to the original onset of the symptoms. And emotional traumas will acidify the bloodstream. It creates hormones that are basically stress hormones that create an imbalance in the body and facilitate the triggering off of these symptoms. So something to do is you want to go ahead and you want to get the delayed immune response allergy testing done so that we can see whether a person has delayed immune responses in their system that may be catalysts for bringing this condition to bay. Now, the people that come to see me with MS, half of them have been diagnosed. The other half have not been diagnosed. And what I find is frequently a person will go through what I call a gray zone with the condition where they have symptoms, but there's no objective evidence, no real measurable, hard measurable evidence that they have the condition until it progresses more. And so it may go through this, working diagnosis of multiple sclerosis. Now, in a few moments, Dr. Kearstan, who's on the show, is going to be giving us details about the differential diagnosis of the condition and how these things, the condition can be treated mechanically before we give you the at-home treatment and the things to consider. The other thing, now this is all in conjunction with with going to the neurologist, and you're going to have an MRI of your brain and a CAT scan. The doctor's going to do an EMG, which is a nerve conductivity study to see that the nerve pathways are intact. A tremendous amount of blood work is going to be done that has markers involved. Our role is to make sure that lifestyle components and natural therapies are being integrated because they have some of the greatest effects. Now, I've explained to you before in the past, but patients that have multiple sclerosis need to get a hair analysis done. What this is, it's a test where we take a tablespoon of hair from the nape of the neck. This is sent to a laboratory where they put it into what's called a mass absorption spectrophotometer. Basically, they clean the hair, they burn it, they measure the gases. Those gases are an indication of what you've taken in your body and what's been metabolized. Why this is so important is there is a big correlation between multiple sclerosis and high or toxic mineral accumulation in the body. That may have been toxic accumulation over a long period of time. It could have been occupational exposure. It could be, predisposition for, bad groundwater. There's many different ways. Now, even if it wasn't causal for the multiple sclerosis, it can exacerbate multiple sclerosis symptoms. So it's very, very important to get this test done, which also is going to give you the nutrient mineral concentration that will help to give us an understanding of whether your immune system is compromised so that we bring an additional balance in with that condition. So we have the alkaline testing that we're going to get done, the immune response testing done, and then we're going to have your hair analysis done. And now we're going to go into the mechanics of the diagnosis and how it takes place neurologically. With me today is Dr. Ken Kearstan. Dr. Kearstan, welcome with us.
Hello.
And tell us a little bit about, what your understanding of with MS and how that's diagnosed.
Well, MS is diagnosed with a combination of, like you said before, testing and clinical presentation. First of all, we see a lot of patients that come in, and a lot of people always like, I have numbness and tingling in my legs, and do I have MS? People always want to jump to that MS. They're always so afraid of having the condition. And MS does have a lot of similar presentations that overlap with other conditions that are actually simply treated and with a simple pinched nerve, and people make that jump a lot. So what we have to do is first take a complete history again, and like you said, most of the time people come in that have this condition have already been diagnosed, through multiple testing. A gold standard for MS is a brain MRI. It has certain signals in the brain that would show that would help diagnose MS.
Right.
At the same time, Lyme disease also presents the same way on an MRI. So when you have these types of presentations, it's so important to get blood work done to ascertain or differentiate between one, Lyme disease, and MS, because it shows exactly the same on an MRI, very similar.
Would that be chronic Lyme disease?
Yeah, that would be something that would be progressive, and people would be exhibiting these types of physical attributes of the condition.
Yeah.
Numbness, tingling, shooting pain, electric-like pain throughout their limbs would be a clinical marker in regards to history. The one that really puts you over the top of would set up red flags if a person was in our office that wasn't diagnosed would be these types of symptoms: electric-like pain, shooting pain, along with double vision or visual problems. MS attacks what we call the bulbar muscles of the facial muscles and the muscles that control the eyes. So when the demyelination condition happens in those nerves, it causes an imbalance in the eyes, causes the eyes to what we call nystagmus or bob back and forth, which would give a patient double vision. So they have to make sure they go through a proper eye exam. Also, in a clinical examination, when we're doing neurologic portion of the examination, which we always do with every patient that comes in, testing reflexes and muscle strength, a MS patient will present, when it's active, what we call, they would exhibit something which is a completely abnormal reflex called clonus, sustained clonus, which we would do a reflex. Everybody's gotten the doctor, they get the reflex and their leg would go up.
Right.
In MS, what you would have is when you do the reflex, you would have a continued pattern effect, like the knee would continue to reflex and bop, 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 bop. You actually physically have to stop it. Same thing with ankle. You would have a repetitive patterning of the ankle. So that's what we call like a spasticity, or what we call an upper motor neuron reflex, which would definitely be indicative of something, central nervous system, or something going on in the cervical cord. So going back to another differential diagnosis, when someone presents this way, we have to make sure that there's no cervical cord damage due to an injury, trauma, falling off a horse, a herniated disc, or something we call cervical spondylosis, which can happen in elderly patients or patients that get older. As they continue to degenerate, you can actually get a compression of the vertebrae and then a bulging of the disc, which pushes back on the cervical cord. When that pushes on the cervical cord, you get a classic symptomatology in regards to of spasticity in the lower extremities and a atrophy or a weakness in the upper extremity. So they would show decreased reflexes in the upper extremity and increased reflexes in the lower extremity. So you have to differentiate between, is there cord damage, is there cervical trauma, is there degeneration, or are we talking about MS? So talking about all these things, it's a myriad of tests we have to put the patient through, and it's a very complete history and a careful examination in conjunction with consultation with other medical doctors and neurologists and going through tests. So it's not just a boom, you got MS because you got these symptoms, because so many of these symptoms that are simple, like I said, a pinched nerve can mimic almost like an MS type of condition.
Right.
So
and
everything in conjunction would give it a diagnosis.
Right. Kind of like I was telling you before, is that sometimes it can be like a gray period of time in which the patient, just doesn't fit into the classic pattern.
Yeah, that's why we're talking about when people come in. If they are coming in, they've had periods of difficulties throughout their life going through this progression. When they finally come to us, they're either at their wits' end because they've been through a myriad of testing and they don't know what to do, or they've been diagnosed and they're getting some conservative alternative care in conjunction with their medicinal care.
How can chiropractic care help the MS patient?
Well, chiropractic care, we're there to help the patient help manage a condition. We're not there by any means, we're not treating the condition itself or correcting the condition. There's no place in that, and we can only enhance or help the immune system response. A person that has MS has physical deficits. They have difficulties. They have spasticity in the muscles. They have muscle hypertonicity, twitching of the muscles. It changes the way they walk, changes their gait pattern. People sometimes have to wear braces and things around the legs. So they're changing the way they walk. They're abnormal, and it puts stress to their spine. It causes soft tissue irritation. So we're there to help manage that condition in regards to getting flexibility into the joints, reducing the muscle hypertonicity, the tension in the muscles, stretching muscles, so that the person, when they're going through their daily life, we can limit their irritation by making them more functional. And then that makes them more pleased and happy, and they can go through their daily life where it's not a strain, walking from the kitchen to the bathroom,
not with as much compromise in their life.
So it's very important that we would treat these patients on basically a regulative, what we call regulatory or palliative type of basis. We're not there correcting anything. We're helping just maintain that. It's just your alignment's off, just like you got a bad tire in your car. If you've got one tire that's going, you don't change the tire, it's going to screw the alignment up. So we can't do anything with the alignment per se because of the MS is a progressive condition, neurologic, that we can't change anything to the nerves itself, but we can help balance the body in regards to the causal things it's doing to the body.
Yeah.
So massage, chiropractic adjustments, stretching, and what the body wants in any type of neurologic condition, whether it's ALS, MS, any type of nerve condition, the nervous system needs what we call afferent input. It needs response. When you hit your elbow and you hit your funny bone, everybody's hit their funny bone. What they do, they rub it. When you're rubbing it, you're not doing anything. You're actually stimulating a nervous response to actually stimulate what we call mechanoreceptors and to help block pain. By rubbing something, you're desensitizing the skin and you're helping stimulate these nerves. You're helping block pain. So when a person has a neurologic condition, any condition, it's always good for them to walk, stimulate. Like I've even said it before, sitting in a rocking chair, back and forth, moving the ankles up and down. There's so many nerve receptors in the ankle and in the back of the neck. Just doing some neck exercises, some ankle exercises, you're helping stimulate the nervous system, and that helps manage that, or it helps block pain, it helps reduce pain, and it helps slow down any type of condition. To sit and not do anything, to lay or bed rest is one of the worst things you could do, and it will just allow that condition to just progress, waste away.
Right.
And if anybody's getting, say, oh, just lay down and rest, it's one of the worst things you can do. Swimming,
you don't use it,
if you're functional, you're strong, you could function, then you should move.
The other thing that we recommend patients do is bring acupuncture into their lives. And what acupuncture involves the use of single-use disposable sterile needles. The treatment doesn't hurt. It's actually very relaxing. And what the treatment does is the treatment is rendered, like if they have difficulties walking, there's a lot of needling that is applied into the lower back and in and around the buttock areas, which are frequent sites of demyelinization. And what happens is that the inflammation around those nerves subsides with the acupuncture, and the acupuncture promotes healing by increasing endorphins and increasing the rate at which the nerves heal. So although acupuncture is not a cure for MS, it can help get the patient out of a bout of symptoms quicker and can help them maintain protracted periods of remission over a long period of time. Acupuncture is also good in helping to treat the urinary symptoms. So, its role is vast, along with increasing the immune system at large. People are compromised, whether it's strictly an immune system response or not. Frequently, when they have MS, they're susceptible for many other things, and getting somewhat regular acupuncture makes a tremendous difference in the quality of life for practically every patient I've come across with MS. So if you have it, I want you to consider it, and we'll show you what that's all about. Because I've witnessed a psycho-emotional component prior to the onset of MS symptoms, we find that managing the stress and managing your daily functions within your mind are important to do as a home treatment for the MS, but also to help manage the stresses associated with the condition. So, Dr. Kearstan, tell us a little bit about the role that medical hypnosis might play for these individuals.
Well, hypnosis is something that's very valuable to the patient, where we can actually help the patient do self-hypnosis at home over time, allow them, teach them some meditation types of things, which is different than hypnosis. But hypnosis is excellent in the clinical setting in regards to, like you said, allowing the subconscious mind, or training the subconscious mind to deal with the condition and to help block out these things that we're dealing on an everyday basis, getting frustrated with physical deficits, getting frustrated with maybe lack of work. All these things are stressors that we add to the stresses of our day can, again, you said, allow the progression. It's like a vicious cycle. The more stressed you are, or the cycle of badness, right? the more stressed you are, the more difficult you have, maybe the more the condition can progress. So we have to try to treat this as a balance in mind and body. And hypnosis is an excellent way to do that, balancing the physical stress and the mental stress, and eliminating that. And through, we do one-on-one sessions where we can actually do the hypnosis with the patient. Everybody could be hypnotized. There's no person that's resistant to be hypnosis. But there is, people are difficult. Some people are easy. That's a whole other show.
Yeah.
But
does it last a long time?
The idea for hypnosis is to last infinitely. It's something that's allowing the mind to exhibit a lifestyle change that you can appreciate, so that the condition, almost blocking the condition out and saying that, okay, this is not going to affect me, this is not going to deteriorate me, I'm going to continue to move on and deal with my life, and not let these little things, or some things that made you get frustrated throughout the day, can totally make them appreciate it in a different way and just keep moving on. So we're not only dealing with, these little markers.
Like
it's a self-empowerment.
Yeah.
And by doing so, again, the mind is very, very powerful. And by stimulating the mind in regards to helping that, you can actually maybe sometimes even cause the condition to go in remission earlier, or allow the condition to not progress as fast. Just by mindset. You've heard of these stories of, children, imagining, the little battle inside the body of the monsters, the bad monsters, eating, getting devoured by the good cells and everything, and actually seeing, cancer go into remission, or lymphoma. Same thing. The body's very powerful, the mind is very powerful, and it can stimulate an actual physical response sometimes. And hypnosis is a vehicle in doing so. It's not easy, but it's absolutely...
It might help to eliminate some barriers.
It's clinically recognized.
Yeah.
It's clinically recognized by the American Medical Association as viable treatment for physical pains, addictions, and so forth.
Yeah.
So it's another just component of managing and hopefully slowing down the condition.
I'm going to tell you about a pet nutrient that I seriously want everyone with MS to think about. Now, what that pet nutrient is phosphatidylcholine complex. Now, that nutrient is basically, it's refined lecithin. Lecithin is a byproduct of soy manufacture, and when it's refined, it turns into phosphatidylcholine. Now, phosphatidylcholine, when taken in, we have your nerves, and we have the synapse, and we have acetylcholine to acetylcholine esterase. That's the actual chemical phenomenon that happens at a synapse. By taking phosphatidylcholine, it allows for a protective mechanism of the nerves by giving the nerves the chemicals that it needs for proper transmission. I believe that a person with MS taking this will benefit from that nutrient. There is also evidence that shows that certain oils have certain precursors or prostaglandins for hormonal regulation, and they help to assist in nerve balance in the body. Borage oil, pumpkin oil, flaxseed oil. There's many different forms. I'm not going to tell you which to take, because what we do is we try to, through history, we try to isolate, what would be the best thing for you, the patient. But the whole application of natural oils in the diet is proving to be a beneficial thing. Coenzyme Q10, 200 milligrams a day. You better go to Costco and pick it up, because it's about as cheap as you could possibly get it at that location. And you really, really, really need to start taking the coenzyme Q10 on a daily basis. It helps with the nerves. It helps with the immune system. I can't tell you how important it is. The other thing is that there's a product called sphingolin. It is an enzyme derived from the myelin sheath of a cow. It is available in a supplemental form, and by taking that nutrient, it can frequently aid in protecting the nerves. Another thing that I am a very big proponent of, irregardless of whether your blood work shows that you are low in it as far as pernicious anemia, or your CBC could be perfect. If you have MS, I am a firm believer that you should be getting intermuscular vitamin B12 injections from your doctor, and that increased level of vitamin B12 in the system helps to promote nerve regeneration at a rate quicker than it would normally. It's so important. I really want you to consider that with anyone that has MS. If your doctors haven't recommended it because they feel, oh, it's within range, you don't need that, what I'm saying is that you getting more is going to help you more. Okay, eliminating anything that's acid in your diet. Regretfully, the coffees and acidic products all have to go. You have to bring your body into an alkaline state. So we're going to take into consideration your diet. Regretfully, diet alone isn't going to do it, and supplementation is going to be in order. We're going to balance out the mind by incorporating clinical hypnotherapy coupled with post-hypnotic suggestion that you're going to be trained to do in your mind. You're going to consider the use of chiropractic spinal manipulation for mobilization of the joints and keeping the nerve supply intact. And you're going to get yourself some acupuncture. It may sound all new. It may sound out there. If you talk to your neurologist or your family doctor about, do you think I could go ahead and incorporate some acupuncture? The first thing out of their mouth is they're going to say, sure, absolutely. I think it's a good idea. And I want you to consider that. For Natural Healthcare Alternatives, I'm Dr. James R. Golding, and thanks for watching.